Hi, my name is Ida. I wanted to make a little video of doing my estrogen injections because I do a lot of trying to help other people who have trouble accessing hormone replacement therapy, primarily trans femme people. I do a lot of helping them get access and helping people learn how to do this. And they don't always necessarily have access to like a nurse, which I'm not a nurse or a healthcare professional or anything like that. But I've been on HRT for years. I've been on injections for like going on 3 years. So I feel pretty comfortable with it. And it's like, I think the word injection makes it really intimidating for a lot of people. They think of intravenous injections, but with estradiol, it's just a intramuscular or subcutaneous injection, which means you're just going into muscle or under skin, and you're just shoving it in there, and it's not that much doses-wise. It's a pretty heavy concentrate, so you don't actually have to inject that much. And yeah, it's not very intimidating. So I just wanted to make a little how-to video. And I guess I'll just plug, like, I'm a member of the Democratic Socialists of America. I'm on the steering committee for our National Queer Socialists Working Group. I'm a member of the Greater Baltimore chapter of the DSA and of the just formed University of Baltimore chapter. So I do take queer organizing very seriously. I also do a lot of Palestine solidarity organizing. I actually just got back from speaking at our ListenToMaryland Coalition Vote Uncommitted campaign's release press conference, where I had the pleasure to stand by some great activists. Yeah, you know, vote uncommitted. Don't vote for Joe Biden. He's a genocider, and you don't have to vote for him. Don't let them make you feel guilty about, like, enabling of a Trump victory. That's the same excuse they had in 2016, and they can't keep playing that card. We can't let weird neoliberal, fasci centrists, tell us we have to vote for a genocider if we want to avoid having like a populist fascist or whatever Donald Trump is. That's not a decision that we have to make. We just have to fight for justice and equality in this country, and abroad, and in the countries where this country manipulates and controls and enables the balances of power. So okay, let's move on to injections. So to begin with, I'm using estradiol valerate. It's a concentration of 20 milligrams per milliliter, and my dose is fairly typical for somebody who is either on anti-androgens or, like me, has had an orchiectomy and doesn't produce very much endogenous testosterone or other androgens very much anymore. So my dose is 4 milligrams per week. So that equates to 0.2 milliliters, so 0.2 of a milliliter. So we have the vial. They'll tell you to use a new vial every month. The truth is, I mean, if you do that, you're throwing away a lot of it, and you really don't need to. The shelf life has been tested on this stuff to last a long time. I think it's at least a year on estradiol that's in castor oil, which this is. I think it's 2 years for MCT oil, which is what DIY producers like Otokonoko Pharmaceuticals tend to use because it's a more stable, longer-lasting oil. So it's worth the investment. Yeah. So first things first, safety. Your main safety issues here are going to be sanitation, so wash your fucking hands. I did that off camera. You're going to want to have like some band-aids, so I have a little first aid kit here. You're going to want to have a band-aid. You're going to want a thicker needle, like 18 or 19 gauge or so. The smaller the gauge, the thicker the needle. That's for drawing, like pulling out of the vial. And then you're going to want a thinner needle that's at least like an inch long if you're doing intramuscular, and at least like, I would say 2/3 or so of an inch long if you're doing subcutaneous. Some people claim intramuscular is like higher absorption. I don't think it really matters. As long as it's in your body, it's not oxidizing, it's absorbing into your fat, that's all that matters. It gets to your blood. So yeah, this is a 20, I think that these are 20, it's blue. Oh yeah, there's color coding. That's one thing that's really cool. I haven't actually memorized the color code. I don't know if you can see that, but blue, which this one is, turns out to be 23 gauge. So yeah, bigger gauge, thinner needle. This is a 1.5 inch 23 gauge. And then you're gonna have syringes. I just get a 1 milliliter syringe. It's divided into tenths because you're only using a really small amount. You can get bigger syringes and they'll pull faster because they have more pressure. They like more vacuum power. I don't know. But I just use these. Waste less plastic. And then you're going to want an alcohol pad. So with intramuscular injections, you can do it in your ass, you can do it in your thighs, you could really do it in any muscle, but it's best to do it in a muscle that's relatively thick because you're going to want to get it deep in there. So I do it in my thighs, like on the sides of my thighs. That's kind of what the nurse showed me to do. That's what a lot of people get shown. Some people, their doctors or nurses or whatever, will show them to do it in their ass. A lot of people get subcutaneous suggestion, which is they'll usually go into the belly, or some people do the tops of the thighs. It really doesn't matter. So some people will tell you to use separate alcohol pads for sanitizing the top if the vial's open. Well, really, you should, just sanitize the top, be safe. And then they'll tell you to use a separate one, but I just use the same because it's alcohol. It's not getting contaminated. So yeah, you just like choose an area on the side of your thigh. So we're gonna like wipe that, starting from the center and doing a spiral outwards. Then we're taking our injection needle. Oop, I dropped it. It's fine. It's clean. It's in a case. It's fine. So we're putting that injection needle while it's still in a case on a syringe. And then you can take the top off. We're going to pull the air into the syringe. We want the same amount of air that we're going to be replacing with estradiol. That way we don't produce a vacuum inside of the bottle and cause it to potentially like splurt a little bit. Doesn't matter that much. Also, it makes it easier to draw if you add air. There's a little pressure. It helps you pull it out. So we're going to, for me, that's 0.2 milliliters for 4 milligrams of this concentrate of estradiol valerate, and that's the more common concentrate. However, with DIY, I see often that people make double strength, where it's 40 milligrams per milliliter, and that's cool. Less to inject is nice. So yeah, you shove it in there, making sure that you sanitize this. You shove the air in, you pull the top of the needle down below the top level, the surface of the liquid, and you push to get all the air out, and then you draw the needle back. And I usually overdraw so that then I can kind of like flick the bubbles out. You want to get the bubbles out. So here's that. See, there's some bubbles. Big bubbles. You really want to get those out. If they're little tiny things, it's not actually gonna, there's no like risk there the way there is with intravenous. You're not gonna kill yourself if you get a bubble in your muscle. It's not gonna give you an aneurysm probably. Whereas if you shoot air into your vein, it will likely cause severe damage. But yeah, so we're going to push that in there and get it to the dose line, which is 0.2. Take that off. And then pull this back a little to pull all the liquid out of the needle. I'm just really stingy. A lot of people don't pull the last little bit out of the needle. They don't care about it like that. But I do. And then we are so we're switching to our injection needle, which is the longer, skinnier one. And before we shove this into our thigh, we're going to push out that little air that we just brought in when we pulled it back before. We're going to make sure all those last little bubbles are out. Yeah. You get like a tiny little drip. So that area that you sanitized, you're going to kind of squeeze around it. And you're going to go in at an angle. I think it's often said like between 70 and 45 degrees from your thigh. You want to the more acute it is, in my experience, often the less it will hurt. because you're going through less layers of muscle. But I think it depends on a lot of things. Sometimes you pick a spot that just hurts more. Sometimes you pick a spot that has a blood vessel that you hit and you bleed a little bit. And it's just remind yourself, it's fine. You break little blood vessels in your thighs all the time from bumping into shit or from strains. So like this is normal. It's not going to hurt you. But yeah, get that in there like a 45 degrees. That's what I'm doing. And you just gotta like push it in and try not to think about it. It doesn't actually hurt that much. It's just kind of scary when you're not used to it. So you get it in there. You get all 0.2 milliliters in there, and you pull out. Sometimes there'll be a little blood, sometimes not. You can like keep a hand on the alcohol pad if it's sanitary still, and you can use that to kind of like press down, but I'm not even seeing any blood or anything. It's a good idea to put a band-aid on it, but yeah, why not? Let's do it. Not just because it stops the blood, but if any of it does leak out, which isn't going to be it's going to be a negligible amount. Don't worry about leaking. It's not a big deal. But if you want to and you're neurotic like me, putting a Band-Aid on there will help keep it against your skin and away from oxygen to an extent, so that more of it will absorb into your skin. Fuck, where's the hole? Yeah, there it is. So you got a Band-Aid. Just like going to the doctor. Okay. So I'm just going to say, as a sign off, like I mentioned, they're going to prescribe you this stuff, expecting you to throw it away every month. A lot of people, like myself, just keep using the same vial and let them kind of stack, get extra vials, stack them up, so that you have extra. Sometimes you or somebody might need it, so it's good to have on hand. And the thing you want to watch out for, though, is, like they say, technically, sure, anything can go bad within a month. What's going to happen if this goes bad, right? This isn't an oil and alcohol concentration. It's fairly sanitary. The alcohol helps kill any bacteria. But if bacteria, yeast, etc. were to succeed in colonizing this little bit of fat, this little bit of hormone, it would get cloudy, for one, because it would be producing the sort of like, particulate matter that comes with the fermentation, and it would most likely might produce a little bit of bubbling or something. But it's the cloudiness you want to watch for. That's when you know it's like tainted. I've never had it go cloudy, but I've also tended to get through bottles I think one lasts me like 5 months or something, as opposed to once a month, you see. So I get like 4 or 5 extra vials per. And then, yeah, this is a medication that a lot of people can't access. A lot of people in the states that have banned HRT, people that don't have their own insurance and can't come out to their parents because their parents are financially controlling them, people who, they live in states where it's legal but Medicaid has poor coverage or whatever it might be. So, it's good to have this shit around, okay, if you get that. So, but just make sure you're being sanitary. Make sure you're cleaning the top when you use it. If it gets at all cloudy, throw it away, move on. Yeah, that's my little safety tutorial. So, Free Palestine, Vote Uncommitted, join a radical organization such as the DSA, mass socialist proto-party with somewhere over 60,000. I don't know, it could be, the number vacillates a lot, but we have a lot of members. We were easily the biggest socialist organization in the United States, so I think that you should probably join DSA. But there's lots of other great orgs too. Just watch out for your trans siblings. And I strongly recommend joining the Queer Socialists Working Group of the DSA. So that's me. Thank you. Bye. Oh, also, it, she pronouns. Bye. I forgot to add also, a really important thing here is needles. What do you do with them, right? So whenever you're done with the needle on here, cap it before removing it. Also, I recommend putting it on before you remove the cap when you're adding a new needle. Always don't touch the needle. Don't ever touch the needle. Don't even touch the base of the needle if it's uncapped. touch the cap. That's what the cap's for. So when you're done with it, cap it. The syringes are plastic. You can just throw them in the recycling or whatever. They haven't touched any bio waste. They're fine. But the needles are bio waste. They are sharp. So traditionally, you get what's called a sharps container. It can just be like a hard plastic container. It could be a can. It doesn't matter. You just want it to be closed somehow, tape over the top, whatever, and write sharps on it. And you can throw it in the trash from that point. In most places, there's not much else you can do. However, there are like clinics, don't do this, but police stations, but there are places that will accept used needles, and you can take them and dump them there. I think like some clinics and hospitals do. I've honestly been amassing used needles for all of these years, not just for estradiol, but I'm on 2 other injectable medications. And when you have just the needles stored like this, you can stick a lot of these in a sharps container. Like I have a medical sharps container that came with a injectable medication like 4 or 5 years ago, I think, before I was even on estradiol, I think. And yeah, so dispose of things properly. Don't risk, putting sanitation workers in a position where they're poking themselves with your needles that had a little bit of your bio waste on them and have been sitting in unsanitary conditions ever since, possibly getting stuff growing on them, so don't poke people unconsensually. Okay, that's it. Bye.